Regardless of socioeconomic status, healthcare is the great leveler. In Nigeria, many lack access to quality healthcare, remain uncovered by the National Health Insurance Scheme, and often struggle to afford basic care. This episode of the Leading Woman Show policy series will look at how policies in healthcare impact the lives of Nigerians using case studies and expert insights. We'll explore how healthcare policies transform lives, highlight gaps in implementation, and inspire action to improve the healthcare system for every Nigerian. Welcome to the Leading Woman Show policy series, brought to you by our sponsors, the National Endowment for Democracy and Luminate. I'm your host, Abosede Jojogan. Today, we will be discussing the topic, transforming lives through health policy. And joining us are Vivian Ihekweazu, a health policy specialist and managing director of Nigeria Health Watch. Next up, we have Dr. Hussaini Abdu, a development practitioner and policy strategist. He's the country director of Care International. Our last guest, Dr. Lola Mabogunje, is a seasoned development expert with 20 years plus experience in the public and private sectors, specializing in maternal and child health, system strengthening, and advocacy across Nigeria. Together, we will unpack the progress, challenges, and opportunities in Nigeria's healthcare landscape. Stay with us. Welcome again. Thank you so much for being here. Today, we're talking about transforming lives through health policy. So I want to start this conversation by exploring why is it even important to have a robust health policy? Dr. Lala, I would like to start with you.
I thank you for engaging me to talk on such an important topic. I'll just go back on the memory lane with all of us, why it's important. Maybe the story will strike a bell to each and every one of us. 20 years back, I had a child that was very sick in the hospital. And I remember he had a cardiac disease and his father was sick. And we were trying to get his medication. And I met the father. The mother had nothing to. So I met the father, we tried what we could, and I told the father, he too was very ill. And he asked me, which one would he face in life? Is it his own health or the child's health? So does that strike to you that if we have had in place a good policy that takes care of health, that child would have access to care, drugs, and everything he needed? But the father was honest. He was very sick. We all tried. But, I mean, you cannot look after that. So in the basic line, I gave you this story to tell us that it is important that we have a good health policy, particularly the insurance in place, to enable people to have access to care, quality care.
I mean, I'll come back to that, and talk a little bit about the National Healthcare Insurance Act and why that's important, because a lot of us might not be aware. But, Dr. Abdul, I'd like to hear from you as well. Why is it important for us as a nation to have a robust policy on healthcare?
Generally, policy is that substrate that connects citizens with the state. It defines a clear commitment of state to its citizens. And so when you have it on health in particular, because the health is a major issue in this country, because it defines the human resource capacity that as a country we can project that can enhance our productivity. And so a healthy country is a productive country. And therefore you need policy that will not only guarantee access to health services, but we ensure quality delivery and also ensure equity in that delivery process. So you need a policy that encapsulates some of those issues to ensure that you have a robust health service and qualitative health service delivery in the country.
Thank you very much. And Vivian, what will be your thoughts on this? I mean, you've heard them highlighting real stories, people having to make choices. Well, why is this important?
Thank you very much for that, and it's really a pleasure to be here. I think when Dr. Lola started, it was very instructive that she started with a human story. I think most of us don't really think about health until we become ill. Health is not one of those things we wake up in the morning and start worrying about, but you do when you have a catastrophic health event or when a family member is sick. That's when you now face the consequences of that gap in policy. And we understand that what policies are ultimately there for, they're there to ensure access to healthcare, education, you name it. Policies are there to provide every citizen with that social contract that links what the government is responsible for and what we as citizens should expect. So really policies are there to keep us citizens protected, educated, healthy, because with the gaps in policies, that's when we now see, challenges in healthcare access, challenges in quality healthcare. And without those policies in place, then we are not able to live the best life that we as citizens expect for ourselves and for our families.
I mean, thank you for that. So, Dr. Lola, what I'm hearing is healthcare policies are important, and having the right policies in place literally defines what, kind of citizens we have, whether they're healthy or whether they're not healthy. But Dr. Lola, give us the lay of the land. What currently exists, so that people out there who don't know what their rights are, what's available, and what they can access.
The country is not short of policy. We have quite a number. One is the National Health Insurance Policy. That is the one that is very key for every one of us. There are other policies. But that policy, if I'm allowed to say it, has been domesticated all across Nigeria, except in FCT. FCT does not have a policy on health insurance for these people. They have a health insurance, but if you don't have a policy, it doesn't tell you what is my right, what is your right.
That's right.
So the key one for me is the insurance policy. There's the emergency health policy, the quarantine health policy that we are trying to put in place. Name it. But the key for me and you that ensures we have access to health, it's the insurance. Because when you don't have something to fall back on. The day you are sick is when you would know you have a challenge.
Yes. And Vivian, do you want to speak to insurance? Because you talked about that mortality. Oftentimes, many of us do not think about our health until there's crisis. And given the work and everything that you know about a recent crisis that we had around the pandemic, how important is insurance?
Okay, well, how important is insurance? I think when we talk about the National Health, what it was, National Health Insurance Scheme, which now transitioned to the National Health Insurance Authority Act of 2022, what that's expected to do is provide wider coverage, ensure that there's equitable access to health insurance. However, I'm sure if we ask everybody in this room, how many of you actually have health insurance? You would find that probably, I'll be very conservative, less than 10%. Because currently only about 7% of people actually have access to any health insurance. 62% of those are in the formal sector, with 1% in the informal sector. And we know our country. Most people are in the informal sector. So what that basically tells us is, yes, as Dr. Lola said, we have a multitude of policies in Nigeria. We probably would win the Nobel Peace Prize or the Guinness Book of Records for having policies. But where we often fall short is A, implementation, B, even ordinary Nigerians even understanding what those policies are.
Yes.
But then also governing all these policies is often a need to even fund the implementation of them. These are huge gaps that we continue to experience. But specifically to health insurance, we are underinsured as a country. But the starting point, I'd say, and I always want to be optimistic, is, the National Health Insurance Authority Act is there.
Yes.
It has now mandated every Nigerian to have health insurance. However, to ensure that actually happens, the ordinary man on the street has to be able to have access to health facilities that they can go to, that when they get there, they have the medication, the health workers. So it's a complete package. So policy on its own will not solve our health problems.
Yes.
It has to be a complete package.
Fantastic. So, Dr. Abdul, you're hearing that. What's coming to your mind? So there's an act, it exists, and it's supposed to guarantee universal health coverage. But it's not something we can go and just grab, and say, today everybody has it. So what comes to your mind?
Yeah, what comes to your mind is what was illustrating, looking at the structure of the country and the level of commitment to the implementation of that act, and the number of people that have so far been registered. And for your information, many times when we discuss Nigeria, we basically see only the formal sector. But let me shock you that it is only 7% of Nigerians that are located in the formal sector. Whether it's the public sector or the private sector, only 7. The very recent labor survey conducted by the National Bureau of Statistics actually says that 93.7% of Nigerians are actually employed in the informal sector.
Wow.
So what that means is that when you make policy that are formally inclined, you are probably targeting only about 7% of the population. And that's how shocking it is. Nigeria's economy, when you take it in its totality, about 67% of it is actually in the informal sector. So Nigeria generally is an informal space. It's an informal space. So if you make policies that are structured to capture the formal space, then you are basically working for a very minute percentage of the country. And that's a crisis. And that's part of the crisis of the health insurance scheme and now authority that has been instituted.
Yeah.
The transition from the scheme to the authority were 2 major transitions. One, the transition from voluntary to mandatory. So the earlier scheme, 2004, was a voluntary scheme. You can decide to do it or not enlist. But the new one, 2022, is mandatory. The second is that they want to capture more, and therefore provisions be made for vulnerable groups. But the challenge with the act is that you are in the informal space does not necessarily make you vulnerable. So there are people in the informal space that are not necessarily vulnerable. So having that mechanisms, the institutional capacity to drive the mandatory nature of this new act is the main challenge. And then funding to capture the vulnerable is also the second challenge around it. So we are in a big crisis. Look, healthcare access in this country is about 80% out of pocket. And you know what out of pocket means? That you walk to the hospital and you have to pay cash to get yourself treated, to go to the chemist, buy your drugs, and doing all those things. This is one of the worst cases you can find, even in Africa. We're not talking about other part of the world. We're just looking at Africa alone. But if you look at the progress that countries like Rwanda had made in recent time with about 90% coverage, you start asking yourself, what is actually wrong with us? Because by every indicator, in terms of the size of our economy, the human resource capacity, the dynamism of the system, Nigeria is not comparable to Rwanda.
So, I see a few eager faces in the audience. So let's take a break and we'll be right back to hear some of their thoughts. Welcome back. Let's take some questions from the audience.
So how can individuals advocate for better healthcare policies here in Nigeria?
Vivian, do you want to speak to that?
What can people do in terms of advocating for better healthcare policies? I think the starting point is for people to even understand in the first instance what policies are actually available, understanding how those policies affect their lives. Once we get past that first stage, it's looking at who ultimately is responsible for healthcare in your community. I'll give an example. Primary healthcare is supposed to be the foundation of health access to everybody. It's a basic level where anybody, if you're sick, you have diarrhea, your child has malaria, you go to a primary healthcare facility. Yet we know in many communities, primary healthcare facilities are dysfunctional. Yet nobody does anything about it because the citizens do not use their collective voices to advocate for their primary healthcare facility, for example, to be fully functional. I think that's an example where citizens have to be better informed. With better information, you're able to now know what you're supposed to be advocating and pushing for. So when your primary healthcare facility is not functioning, then you should know. You should go to your local government and say, listen, there are no health workers in my local PHC. Why is that not the case? So it's about citizens using their voices and using their voices for good.
Right.
And that's for good in terms of improving healthcare access.
Fantastic. Do we have another question?
How can we ensure that healthcare policies are effectively implemented across all regions?
Fantastic. All right. So I'll let both Dr. Abdul and Dr. Lola take that. But let's start with you, Dr. Abdul.
Thank you very much. I think that's a good question. And I think my colleagues' response to the first questions did capture some of the issues here. One is, it's important for us to understand these policies in the first place, the structures and institutions that have been put in place to support the implementation of the policy, and then understand who are the key players. So that's more around analyzing the structure to have a very good understanding of it, then you know whom to engage. But it is also important that we continue to express our voices on some of those issues. We can do those things collectively and we can do individually. Collective actions sometimes work much better than individual voices. Sometimes when you express yourself, you found better security and solidarity when you are expressing it in a collective. You don't have to form an organization, you don't need to have that, but if you have platforms that can help do that, it helps a lot. And we're living in a new world, the world of technology, where we can, one incident that you found in a particular location, and you just tweet about it, or you put it up on your Facebook post. You don't know the number of people that it could help galvanize and the action that could follow. And we have seen that kind of situation with a lot of issues in the country in recent time, whether we are dealing with issue of police brutality or crime at a particular spot, just that spur of the moment expression of those issues can create an outrage, and that can ensure a proper action is taken. There are surely diversities in terms of these policies and how they are implemented across the country. But if we want to see them implemented everywhere, then we must report them and we must be able to take collective and individual actions around them.
Thank you very much. Dr. Lola, what would you say?
I just want to add more to all of you. My two colleagues have used two words. You must be informed. If you are not informed about any policy and what is the content and what the expectation, you cannot act. And he used the word action. She thinks an individual, but advocacy is a game of numbers. The more you are, the more people think it's an issue for everybody. If it's only me making a noise, they will say, oh. But if it's a group, like he said, bring yourself together and advocate for what you believe in. Be the voice of those who don't have a voice, the voice of the voiceless in your community. When last did you visit your primary health care that is for you? Every community has a primary health care and it's yours. Even visiting there is taking an action. Call your friend, let's go and see. Is the primary health care functional? If it's not functional, what is needed? There's a campaign of many young people, make your hospital work in your community. It's on now. It's gaining ground. So if you can just do that, for the group of you living, check your hospital, are the workers there? Absenteeism among workers, it's huge. So if they know you go there, you are interested, they would come to work. If they are not there, then you take word to your councillor. If your councillor does not hear, we go to the chairman. If the chairman, they will write officially to the member and the government in the state. But the point is, you must take a visible action if you want anything to work, particularly health. Understand the content and have a collective action to make sure it works and follow up.
Fantastic. Well, that has been very insightful. Let's take another break, and when we get back, we'll hear from the streets on this topic. It was great to hear from our audience. Now, let's get back into the conversation. I want to talk about healthcare disparities. We know that they exist. So let us sort of explore, why do these healthcare disparities exist and what can we do? How can policy change that? Let's start with you, Dr. Abdul.
Yeah, disparities are functions of inequality in the system. And, you know, looking at Nigeria's Gini coefficient, Nigeria is one of the most unequal countries in the world. The structure is that, and then I always like to give an example when I speak about inequality of the richest African being a Nigerian. And I always say that probably the poorest African is also a Nigerian. And so the distance between that richest Nigerian and the poorest Nigerians defines the extent of your inequality. So unequal access, unequal income creates unequal access. And therefore, you experience certain level of disparities. That's at income level. There is the geographical one, between the rural and the urban. People in the urban area seems to have more access than those in the rural areas because, again, the way our governing structure is defined is that we give so much preference to the urban, and then our conception of development is urban inclined. And take, for instance, today, every state governor wants to have an overhead bridge. Every state governor wants to have an airport. And that's what defines development to them. So hospital health facilities are concentrated in the urban areas. The healthcare personnel are also concentrated in the urban areas. So you have that disparity in terms of geography. Then you also have regional disparity because, again, as a country, the level of education, development, and all those things, you find those disparities within the country, north, south, structure of the country. A lot of cases of people who were backstage were talking about immunization. Northern Nigeria have one of the worst expressions of it. Maternal health crisis is actually a crisis of Northern Nigeria. So you find those kind of disparities. And there's also gender disparity between male and female, and that also expresses itself even in terms of region. In some contexts, a woman cannot even access hospital without the husband's permission, and that creates or limits access. So these are the differences that informed the access concern. Of course, policies can deal with such things, but policies need to be nuanced enough to understand these layers of disparities and actually be able to respond to them.
Fantastic. Dr. Lola, what would you add to that?
I just want to remind us that there's a policy that there should be one health facility per ward. Everybody should have that understanding. How big a ward is could be the cause of the problem. So if the ward is very big, like what we have in Kano, I don't know how one health facility could take care of that ward, but let's have that one, a functional health facility. Let's have it functional in the ward. Functional means adequate staff,
Yes.
and enabling environment. That's the first one. That the hospital looks like a hospital, not like we cannot even take our goods to, which is what is in most rural community. Health service providers, there's light 24 hours, there's security.
Yes.
So it is expected that we have it everywhere in the rural community. Do we really have it?
That's the question.
Are we aware of this? Have we tackled our LGA chairman that what is this? We had this. Why am I not having in my ward? We all belong to a ward. Let's know that. And as long as the issues my colleague described is existing, we'll always have disparity. And as long as education does not empower me, you women, to take our rightful hold, there will always be a disparity. Education, empowerment makes you know what you should. Yeah.
Absolutely. So, Vivian, disparity. How have you seen that manifest? And how are some of the ways you think that policy can address that?
Okay, I think I'll pick up on something that Dr. Lola mentioned. I met Dr. Lola in 2017. We did, I was invited to do a training on educating or making women better informed to advocate for policies around family planning.
Right.
And I remember one of the things that was emphasized during that training was about leadership. We have significant disparities in terms of women in leadership positions. And when we talk about health, we look at who ultimately is making decisions about women's health.
Yes.
We often find that women are not sitting in those seats making decisions about women's health. And how does that manifest? An example was given how when a woman needs to, if she's in labor, she has to ask her husband for permission. These are dynamics that are just existing in our country and we can't get over. When we think about how do we prioritize certain things that women need more than anything, family planning services and commodities, how are women informing how those policies are governed? How are women informing how women are able to access those services in the first place? Primary healthcare is that level where, as I said, everybody should have access to healthcare. How are women now receiving services in those facilities? What we find is when we don't have women in leadership positions, we are not able to make those decisions that influence our ability to access quality healthcare. So I think one significant disparity that we see is in who ultimately is making those decisions.
Absolutely.
When it comes to prioritizing things that disproportionately affect women. And I think ultimately, if we look at some of our stats, where we have some of the worst outcomes, the number of women who die giving birth in Nigeria is unconscionable, putting it very bluntly.
Yeah.
There is no country in this world where it's normal. I can think of, like, for instance, in the UK or the US, if a woman dies in a hospital, the hospital is almost shut down and there's an inquiry. We're losing women every day, every minute, but we're not really sensitized to think that's not normal. So if we are able to have women who are in the forefront of some of these issues, making those decisions, we look at our legislators, the Senate, how many women are there making those policies and laws?
Yeah.
We don't have enough. So addressing some of those disparities, I think, is a starting point. And the gap is wide, but, you know, as I said, I like to be optimistic. And we have to keep pushing. Many of you young girls in this room, you have very powerful voices. So it's about making sure that they too have that platform to reach those levels where they too, you know, can use their skills and knowledge.
Thank you so much. And I'm really glad that you introduced healthcare leadership, which is where I was going to go next. Let's talk a little bit about that. How is it that, at least globally, you know, women are 80%, I believe, or at least 70% of the health workforce. But then when it comes to the leadership, it's men. Even the National Council on Nursing in Nigeria that has, I'm sure, 90% women is led by a man. So what is this challenge and how can we close this gap? Dr. Lola, tell us.
It's a complex problem. She mentioned the leadership role. That it's a course that is done for women on leadership. And I had to think of it. Women Affairs was supposed to take a lead. It's not a good memory for me. We brought people to train women on being leaders. And we wanted a collaboration with Nigerian government so that it could keep happening. Yes. And we'll develop women that will become assertive like them to take their role. Gone with the winds. The government then, not now, I don't know, never came to that meeting. Our leader, you are aware of that. Yes. So when we keep losing women, it was a woman leading actually, but she didn't think it was important for her to attend and make sure they signed a pact where we will roll out at least 30 women being trained as leaders. Then the women we have as leaders, are they really leaders? Let's go back to defining leadership for women. Leadership is not just you being in the forefront. Are you transforming the life of all the women in this place? What exactly are we asking of women we put in leadership role? I have a different concept after that. That it's not about gender. It's about your value before I can put you in a place. What are your values? What would you want to see? Have we asked anybody who put in that leadership role after they finish their tenure, what did you achieve? Yes. It's a good question. We should stop asking. Not the men, no. They finish. But the women will put there. Okay, you finished 4 years. What did you do to improve a woman's life? You will list it for us. If you didn't do anything, don't come back.
So, Dr. Lola, I hear you loud and clear, but are these not some of the challenges where women, as you said, are not prepared for leadership, right? And then all of a sudden, they're thrown, the few that are thrown into leadership roles, and then the expectations of them are higher. Because if we're asking women for 4 years report card, all the men that have been leading, have they given us report card and they have been coming back? So the issue is we acknowledge that some women, when they get into those positions, they don't do well, but they are not even prepared for leadership because society has not said this is one of the roles that you should play. So we understand that there's a gap there. And I think that we must ultimately prepare more women for healthcare leadership if indeed we want them to take those positions. But I think from what I'm hearing you say, we actually don't want them to be in those positions. So we have not invested in ensuring they have the right skills to be there.
No, I think you got me wrong.
Yes.
That there was a plan, and I'll hold on to it because I was involved.
Yes.
To start building a crux of women in leadership.
Yes.
That instead of us traveling abroad,
yes,
the people will come and train at least 30 per quarter. Do you understand identifying 30 women per quarter or 36, one per each LGA state? Then we'll have about quite a number.
Yes.
But we did not take it up.
Because the government,
the woman leading them did not think
but she represents the government.
No, she didn't even come for the training.
Yes, so no, I hear you. I mean, Dr. Abdul, would love to hear your voice on this. What is this major gap that we continue to experience with women's leadership across board, but particularly in healthcare?
I think the crisis around women leadership in health, and I use crisis deliberately because I think women should be in the lead, and that's the global trend, and that is very important. But it is a reflection of the same crisis at a much broader national level. If you look at the public space and check how many women do we have today in leadership position, look at our National Assembly. How many women were elected?
Yeah.
Look at the status of assemblies. Yeah. In the northwest of Nigeria, we have 7 states.
Yes.
And of that 7 states, only 1 state have a woman elected.
In state assembly.
In the state house of assembly.
Yeah.
And almost 6 out of the 7 states have never, since 1999, elected a woman into the Senate of Assembly.
Yeah.
6 out of 7. And then look at the Executive Council at the state and also at national level. How many women do you have in those positions? So leadership has been, in our typically patriarchal setting,
Yes.
has been largely associated with men.
Yes.
And so people, unfortunately, including women, have been socialized
That's correct.
to accept and believe that leadership has to be provided by men. And so that socialization process is seen reflected even in some of the most educated community health care service providers,
Yes.
are some of the most educated community, because it's not easy for you to go and be trained as a nurse or a doctor.
Yes.
It's kind of one of the most rigorous discipline. You check, even in the bar, they call themselves the learned community, lawyers. How many women do you actually find in those spaces? So I actually think that it's a major concern. And for the healthcare, particularly that you have a lot of women in that profession. So it is not just leading their own associations and all that, even leading the health facilities. Leading the health facilities from our primary healthcare facilities at the community level to those ones that you have in the tertiary facilities. Just check around. How many of them are women? And I think this is what we should be interrogating. These are questions that we should be asking. And it is only when we ask those questions and insist on them. And I'm aware that there are young medical professionals who are actually asking those questions in their respective domains. But I think we can add our voice to those conversations and ensure that we continue to encourage women's leadership in those spaces.
Fantastic. Well, I mean, with that, please give them a round of applause. All right, let's take a quick break again. And when we return, we'll hear from some Nigerians out there on today's topic.
Yes, I do.
Yes, I do.
Yes.
Yeah.
No, I don't, because one, I think it takes time when you want to use NHIS before they answer you, before they attend to you. It takes time, kind of. So
No, I don't use NHIS.
Okay, yes, I use NHIS, and challenges, numerous. Sometimes getting your HMOs to send you a code. There's a code thing that they do before they issue you something that you take to the doctor and all of that. And sometimes they tell you there's no network, and you get so frustrated that you just say, okay, I'm no longer using NHIS, I'll just pay for my money.
Drinking, smoking, living in a dirty environment, drinking bad water, and not exercising.
I think excessive drinking, smoking, and all that.
yes, I will go for eye care service.
Why?
Okay, I'm actually having challenges with my eyes, and I would like to explore the opportunity that is in that.
I think I would like to get eye care service
Why?
because I wear glasses, and I think I'll be happy if I can get a free eyewear.
It's going to be free dental services.
Why?
Because I've had like an issue with my teeth for the longest, and because of the whole stress of having to go to the hospital here, I've not been able to do it. So if I was to access like free services, it would be that. What about you?
Same. I mean, even though I'm a dental student, then dental services are very expensive. So I like to do stuff on my teeth for free.
So some interesting thoughts there, but let me come back to you, and we want to really end this conversation on a high note. So let's hear from you about your thoughts on how we really transform lives through healthcare policy. We haven't talked about the power of technology, innovation, some of the issues around mental health that are now becoming critical. So what are some of the ways that you think we can really, truly transform lives through healthcare policy? Dr. Lola, let's start with you.
To start with, every one of us must understand which policy and the content. Because we're going back to what our leader, I call our leader, Vivian, said. If I do not understand something, I cannot communicate it. If I don't have something, I cannot, what I don't have, I can give it. It's what you have. So going back, every Nigerian must understand what policies are available, not just understand the content. And to make us do that, we must empower, particularly the women, to understand. You can translate these policies in various Nigerian languages. We can read. We must develop it, or the radio must communicate on it. I mean, if I can't read, I can listen to radio. So there must be a consensuous effort by all of us to make sure people can understand the available policy, particularly the insurance one, what is in it for you, and why you need to do it.
Fantastic. Thank you very much. Dr. Abdul, let's hear from you.
The truth about it, if we have a comprehensive social register, and we do have,
Yes.
it was excellently done. And the people we have there are quite key. And so if we are using the social register to actually provide some of those funds to people in the register, we can as well enlist anyone who is in the social register, because the law provides for support for vulnerable groups. And therefore, the social register is a classic conception of what the vulnerable groups are.
Yes.
So we can insure them. And so in addition to what the cash that is being transferred to them, they should also enjoy the insurance. I think you raise the issue of mental health. And for me, that's a major issue for me and the subject of concern.
Yes.
I think we have made a little leap, progress, moving from lunacy policy to now mental health policy that has been signed in 2023.
Law just last year.
Oh yeah, just last year. So at least that shift from that lunacy to mental health, quite key. We need to take mental health issues to be very, very an important issue, almost like how we manage the HIV/AIDS concerns in those days. Workplace policies on mental health will be very, very key.
Yes.
That we use this law and ensure every workplace has a mental health support policy. Yes, thank you.
Fantastic. Vivian, what will be your final thoughts?
I think my final thoughts are probably centered around two issues. The first one is, again, looking at this room, it's full of young people. There are more of you than more of us in that other end of our lives. And I always get encouraged when I see young people with the creativity. I see so many of them today, production, etc. You have an amazing voice. You have a loud voice when you put your voices together collectively. But to effectively use your voices, you have to inform yourselves on what policies are actually there. And when things are not working, like primary healthcare, I always use that as an example. Because when primary healthcare works, a lot of our health problems in Nigeria can and will be solved. When primary healthcare is not working, ask why. It's not just a question of saying, okay, and accepting it, which we're very used to do. Ask why. You have your social media, digital technology, all of these things. You're more adept at this than many of us. You're digital natives. You've grown up in an age where your voices can instantly be heard because you have access to these social media platforms. Use your voices collectively for good. And that good is to improve your access to healthcare. Whilst you may be young now, you may not have that urgent need, but as you get older, you will find you have families.
Yes.
Healthcare will hit you. Your child is sick, your spouse, your family, your parents. My parents are in their 90s, I'm fortunate. But their health needs are far greater than when they were younger. So first of all, use your voices collectively. You have that power in your hands. Nobody should ever tell you that you don't have it. As someone once said, the power, the office of the citizen is more powerful than the office of the president. It is. Second of all, digital technology. We know we can't solve all our issues in the traditional ways. You have grown up in an age where digital health is now available. Yes, use digital technology effectively to improve access to healthcare.
Fantastic. Please give them a round of applause. It's been such an insightful conversation on today's episode, and we would like to say a big thank you to our guests, Vivian Ihekweazu, Dr. Hussaini Abdu, and Dr. Lola Mabogunje. To our audience, thank you for being a valuable part of today's discussion. Don't forget to subscribe to our YouTube channel, follow us on social media to share your thoughts on today's episode using the hashtag on your screen. I'm Abosede Jojogan. Remember, women's leadership can change everything, everywhere. See you next week.